Okay, so now I have some saline flushers and I have some heparin flushers. So we'll be ready to go. I'm going to open up my kit first, and in here I'll have a mask. So I want to put my mask on. Anybody know why I want a mask?
So you don't sterile procedure infection.
Will your patient have one on too?
It depends. Patient can, especially if they have like an infection going on, or you can just ask them to turn their face to the side. Now, has anybody seen the video yet?
Yeah.
Okay. Can you hear me talk if I have my mask on?
Yes.
Can you? Okay. So I'm going to, first I'm going to get my clean gloves and put them on to remove my old dressing. And I'm going to observe my site before I remove my dressing. I'm going to note for any redness, any drainage, any abnormal looking things. I know that they did this spot like after they had removed the dressing, but I mean, this is a clear dressing. We can see right through it. There's no need to palpate around open without the dressing on it, in my opinion. So I'm going to remove the Tegaderm. Which can be a little tricky. I'm going to beat you to the handle on. There we go. I'm going to remove it kind of in the direction that it was inserted in, because most of these are sutured in, but I don't want to accidentally dislodge it and pull it out more. So that's why I go towards the direction of the insertion site.
Okay. You see him put that shit.
Okay. So now it's open. That is most vulnerable. But what did I not say in the beginning? We're going to check the order. We're going to check the name band for identification so we know we're doing the right thing. Alrighty, so I'm done with these gloves. I'm going to toss them in the garbage. And I'm going to proceed with the rest of my kit. This is all sterile in here. I'm going to take my gloves out. And of course we would have a table, a bedside table here. I'm going to just step over here in order
Here you go. Come on in. You and your plastic penis. Okay, she's coming up there for plastic irrigation.
And you got it on camera.
They were on
Right.
What size do you need? Medium. You grab medium, a box
And I
of
can
medium,
touch this
or
now
two
since
boxes
we're
of
all
medium.
sterile.
Maybe on the top. I think the orange box is on the top. Thank you.
And then on the inside of here, I'm going to get our,
Okay.
this is probably the chlorhexapine or betadine, depending on your hospital policy. I'm going to activate it by squeezing it. And then I am going to start at the insertion site. and then just cleanse around it. I want to cleanse all the whole area that I'm going to have my dressing on, and I'm going to let the air dry it. So then I'm going to throw that away. As we let this dry, you notice that each of my lumens are clamped, and that's the way you want it. So I'm gonna open this dressing, which this package is sterile, this hand is not. So I'm gonna take my dressing out. They're all a little different, so this one's very small. I'm going to take the backing off of this one. This is different than others. Okay, I'm going to place it over the top of my
I saw this before.
Nice and tightly around here.
I guess.
They were buried. That's the only reason I couldn't.
Okay, so now I've uncovered.
That's the only reason I did it.
Actually, you can take my mask off.
No, I'm saying like that's
And then I want to put my name. This one doesn't have that on it. Most Tegaderms will have a little sticky where you can put your initials, your date, the time, and put it on here. Because you definitely need that, because every depending on your hospital policies, every 3 or 4 days the dressing needs to be changed, or whenever there is some soiling underneath the dressing, some leaking. If you have any, you don't want that blood to sit there, and it's a very good medium to create problems, infections. So,
how often are these changed?
it depends on your hospital policy.
Hospital policy?
Ours is like every 3 days. Now, if you would have a gauze underneath here, when they're first put in, they usually put a gauze on here because it does seep a little bit. Then it has to be changed the next day. So I found a little bit of a thing that I can put my initials on. So today is what? 14.
Things I touch, I know what you're drawing. So like I've had some people like I know every video.
So this one is so I don't want to put it close to the insertion site. Now, that is all that the video showed, but it's not a complete dressing change according to hospital policy, because we've changed these tips out also. But as far, we don't really have any other change them into, but you would clamp the line, unscrew them from here, discard that, and then you can alcohol wipe it, and put a new tip on it.
And that would be clean. Clean procedure.
That's sterile.
It can be clean, because you're not really touching Now, also, and we don't have it here, there's little bitty orange caps that fit on the end of these. Each hospital uses those now. And their cap has a little sponge full of alcohol, and it just screws right on. and it stays on. Like when we're gonna draw blood, I'm gonna show you how to draw blood out of that. You would remove that cap, and then when we're done, you'd put a new cap on. And when you have IV fluid tucked to the center line, every port on the IV line has to have one of those little orange caps too. That's just another layer of protection for the patient. So is there any questions about this dressing change? It's really pretty simple, you just need to keep it sterile.
So do you do the alcohol swab, even though there's the alcohol swab orange cap on there as well, like in a hospital? So you know how like you swab it for 15 seconds?
Yeah.
Okay.
Okay.
Anything else?